Now, these AEDs are great. This is a electrocardiogram with your heart. You can see how it looks funny, you know? That's what they're talking about, ventricular fibrillation. There's also ventricular tachycardia, but they're all irregular heartbeats. They're not working properly, you're not getting oxygen circulating. So, what the AED does, it shorts it out. It causes it to go like this, and then it removes a charge, and your brain will restart it with a proper waveform like that. And these things are very simple. This isn't the one I trained on, but they all look pretty much the same. They take care of everything. They can sense the heart. They tell you what to do. They all talk. There's some older ones that aren't as deluxe like that, but it does tell you what to do. And it is simple and safe to use. Next, please. In fact, it's really simple. You turn it on, you follow the instructions. They all have something like this. They kind of show you what to do in an order that you're supposed to do them in, and then they have a little button here that it will tell you, step away and shock if and when that's necessary. Next, please. What is important is placement of the pads. Do you think you can do this with a person's shirt on? No, that's not going to work, is it? It's not going to conduct anything. And you have to, there's a really prescribed location for these, and you have to get them on so that they make good contact. There's an adhesive on there. You peel off the adhesive, and you put it on. You want to get it on as tight as you can so it makes good conductivity, because it needs to sense. If it can't sense that, it's going to tell you that, and it's not going to work, and you've wasted time. But it's pretty simple. You kind of see where this one is, and then this one's sort of diagonally off to the side. Next, please. Because your heart's not really centered there, so it wants to have this shock like this. It's actually back and forth. If the electrodes are too close together, it's just going to travel on the skin. It may even have a hard time detecting the heart. So that's why you want to have one up here in the corner and then down here. A lot of times they'll even tell you to put it on the side. But not up here, down here. It's up here like this. Okay, next please.
Mr. Peterson?
Yo.
Will the AED tell you where to place them? Like you said, some go on the side or some will go on top. Like, will it tell you where the AED?
It'll have pictures of it.
Okay.
But it's not going to say, put it here or there.
Okay.
That's one of the things it doesn't tell you. That's why I want to point this out, where and why to do it. And like I said, you need to do a high quality job of putting that on quickly, but you need to get the whole thing on there, no wrinkles or anything like that, as best you can. And well, it is safe. There is a lethal shock that it uses. So you don't want to be in a wet area with them. I mean, if they're out in the rain or something, you got to bring them in. You don't want them to be on a metal tabletop or something like that you're touching. And it will tell you, back away, and then it will make you push a button. So everyone should not be touching it when that shock is delivered. And they're saying also that you don't use this on a child, someone under 8 years old. Next, please. This is their 3 components to a successful resuscitation. Of course, as always, the first thing you do is you call 911. Better yet, if there's other people there, you have them do it. Not just one person, at least 2. And then you learn from the previous video about the 4 components of high quality CPR. Depth of 2 inches, full chest recoil, rate of 100 beats per minute, and minimal interruptions. And of course, early defibrillation. You've sent people up to find that AED. As soon as they come back with it, you open it up and you put it on. Next, please. AEDs, they're more and more common these days. They're in airports, they're in schools, they're in the shopping malls. Can you find the AED in this picture? See it? You see right up there? Right above Austin? This is when they're bagging groceries at Cub Foods. It was right there. They're everywhere. There's one right outside the door there to the entrance of the gym. You can go take a look at it. Because as they mentioned that If you're, in a school, this is your school. You want everything to work here. If you see that there's something wrong with it, it's gone, there's fluids come from it, or it's burning or something like that, you should go tell someone about it. Because it's important that you have that there when it's necessary. But it's a simple thing, and just like the simplified hands-only CPR, it's something you can do. It can't just be Jackson. It can't just be the safety captain. He may be the one on the floor. Then what are you going to do? Any questions? You think you can do this? You think you can help someone? They've simplified it a lot. AEDs are simple and smart to work with. It's a pretty good deal. Okay?